fond memories for me because many years ago, I've been coming in and out of Davao, trying to help propagate and push the initiatives of continuing medical education for both the PCP and the Philippine Heart Association. Most recently, we were also instrumental in putting up the accreditation for the training program of Davao Medical Center, and they are just about ready to accept. It is a concern for general attorneys. It is a concern for general practitioners. It is a concern for the family physicians, and it is the concern of everybody, even the lay people. We believe in the Philippine Society of Hypertension. And I have been one of those that initially espoused the saying that our advocacy, not only for the Philippine Society of Hypertension and the Philippine Heart Association, but also for everybody, that all Filipinos should know their blood pressure. Kinsa man din nga, wa ko know sa ilang blood pressure to our patients. Because, malay mo, makakita ng pasyente, bisang pag nagkonsulta sa imo for some other reason, makita nimo, incidentally, accidentally, that the patient has an elevated blood pressure. And at that point in time, maybe you can do something about it. Which brings us to the point that historically, the problem of hypertension was discovered or was noted something like serendipitously. Serendipity is a discovery by accident. Serendipity is a finding that was not purely intended, and that this finding will hold significant meaning and impact on the field of whatever specialty one engages in. And I would refer this to an experiment that was done in a winter, December winter, and this was referred to as the experiment of an Irish priest named Stephen Hayes. When he noted that when the horse's skin was cut, especially when there was something that spurted out of the skin or under the skin, you know that there must be something that pushes the blood out of the body and spurting like hell. And so he did a December experiment. This was subsequently known as Hale's force by tying down. And from then on, there were some or a lot of interest that were generated about blood pressure to the point that they have identified an excessive level of blood pressure, which they later termed hypertension. In 1931, the British Medical Journal